Hey, healthcare friends, do you dread doing your notes every day? Do you feel like you can never get ahead of charting? If you're shaking your head yes, keep listening. Freed AI is a medical scribe on a mission to free clinicians everywhere. Freed AI listens, transcribes, and writes medical documentation for you, written in your style and ready the moment the visit is over. All you have to do is give it to your patient. Just imagine leaving the office at the same time as your last patient. Freed is HIPAA compliant, secure, and takes less than 30 seconds to learn. Artificial intelligence cannot replace you, but it can do the administrative work that no human should be subjected to. Get back to doing what you love, helping your patients, and let Freed AI do the rest. Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. As always, go check out that top 200 study guide. It's a 31-page PDF. I've put it together. Great resource for those out in practice as well as those preparing for board exams or pharmacology exams throughout your career. So simply an email will get you access to that. We also get you an email when we've got new podcast and other content available as well. So again, reallifepharmacology.com. You can find that 31-page PDF. All right, the drug of the day today is Minoxidil. So this is a medication I don't see used terribly often anymore. I used to see it a little bit more earlier in my career, but I got a special request to cover this one, so definitely wanted to highlight it a little bit. So the brand name of this medication is Lonitin. Obviously, this brand has been discontinued. Again, minoxidil is not frequently used anymore. However, we do, from a topical standpoint, have the product Rogaine, which many of you may be familiar with as far as that utilization for male pattern baldness. I'm going to focus mostly on the oral systemic use and some of the issues and concerns there, but we'll touch on briefly the topical agent as well. All right, so uses. So minoxidil is a direct-acting vasodilator, so as you could expect from a systemic standpoint, it can lower blood pressure. And indeed, from the systemic standpoint, that is the primary indication, is to manage hypertension. With that said, it should only be used in refractory cases and typically by cardiology or specialty that has experience in using this medication. The other indication I alluded to, hair growth stimulant. Mechanistically, how does this work? So by producing vasodilation, relaxing arterial smooth muscle, not so much the veins, but the arterioles, it lowers blood pressure. So it's a direct action on the arterial smooth muscle. And stimulation of hair growth is basically similar to that mechanism. So by applying this topically, we're going to increase that vasodilatory effect on that localized area, obviously increasing that blood flow to that area, and obviously looking to stimulate growth activity in those hair follicles. All right, so the indications: severe resistant hypertension. Topically, we're going to be using this medication to treat alopecia or hair loss. Really, really important patient education point. The topical side of things, usually pretty well tolerated. You might get some irritation, that type of thing. But from a patient expectation side of things, this takes a long time to work. So it's going to be months before we're going to see any benefit in managing alopecia or the hair loss. So very, very important thing to recognize. Make sure patients aren't quitting that medication too quickly if that's what they're trying to use the medication for, and obviously looking to get that benefit. All right, switching over to the oral medication, adverse effect profile is significant. And that's obviously one of the big reasons why this is a refractory medication for patients with hypertension. Adverse effect profile, hypotension. We can drop blood pressure too far. That's obviously common sense. Big issues with this medication. So fluid retention, so edema. Often loop diuretics are going to be prescribed with this medication and potentially should be prescribed in this situation in most cases. The other big issue, reflex tachycardia. So it can really increase that heart rate. And this is why it's typically given with a beta blocker. So there are actually boxed warnings with this medication. Minoxidil, now we're talking about oral systemic therapy here, can cause pericardial effusion. It can worsen angina. And, this is really the primary reason why it's a last-line antihypertensive agent. Okay? So definitely recognize that. If you're not comfortable with using this medication, you better recognize that there's warnings here, and you better get some help, get some expertise involved with that. So appropriate use, again, kind of under this warning umbrella, give under close supervision. Usually it's going to be with that beta blocker. That's to prevent that reflex tachycardia and increased heart workload. Also, typically going to be given with a diuretic, and that's to really reduce that risk of that serious fluid accumulation from this medication. One other thing I will mention, if we're giving this medication systemically, we can also have the unwanted hair growth adverse effect. So, for instance, in females, if we're using this medication, we may get unwanted facial hair, for example. So pay attention to that. That might be an issue, obviously, with some patients, for sure. All right, with dosing, I really, again, want to emphasize this medication is typically going to be used at the end of the line. Many patients will be on 3, 4, 5 blood pressure medications already, and we still can't get that blood pressure down for whatever reason. Obviously, I'd want to look as a pharmacist to make sure that they're not, taking any, illicit medications, prescription medications, over-the-counter medications that would worsen that hypertension. That's one of the things that I do whenever I see a patient on a bunch of different blood pressure medications, is to make sure that we're not causing more issues with some of the other medications that the patient is taking. So definitely pay attention to that. But with the dosing of this medication, typically going to start at 5 milligrams once a day. Again, this is for the management of hypertension. Increase that, gradually in intervals of, 3 to 7 days in that neighborhood typically. Usual dosage range is going to be 10 to 40 milligrams per day. And it's actually kind of unique that it's the recommended dosing is based upon how much the supine diastolic blood pressure is reduced. So if it's reduced less than 30 millimeters of mercury, it's recommended to administer that medication once daily. And if supine diastolic pressure is reduced greater than 30 millimeters of mercury, it's recommended to give in divided doses, usually 2 or 3 dosages there. So kind of a unique thing with the dosing that I wanted to point out there. From a pharmacokinetic standpoint, I mentioned the fact about using this medication topically. From a pharmacokinetic standpoint, again, it takes months to work. Very, very important. Obviously, for systemic use, oral use, that onset of action is going to be a lot quicker than that. We're looking to reduce blood pressure. That onset's going to be in the range of 30 minutes. That peak effect can take, up to a couple of hours, typically in that neighborhood. All right, let's take a quick break from our sponsor, and we'll wrap up with drug interactions. If you're in the market for any pharmacist board certification study material like BCPS, ambulatory care, geriatrics, BCMTMS, NAPLEX, go check out meded101.com/store. We've got tons of resources there that have helped thousands of pharmacists pass their board exam, and we can absolutely help you too. Each study package is updated annually and specifically tailored for the content outline of each specific exam. So go take advantage of that, support the sponsor, meded101.com/store. All right, wrapping up with drug interactions. There aren't a ton with minoxidil, which is, obviously a slight positive with this medication compared to all the boxed warnings and different things with it. The big things that I'm thinking about is drugs that raise blood pressure and drugs that lower blood pressure. Okay, so first off, drugs that raise blood pressure, I'm thinking stimulants, I'm thinking pseudoephedrine, I'm thinking NSAIDs. So these are all medications that can potentially increase that increase that blood pressure and kind of oppose or counteract the antihypertensive effect that we're trying to have with minoxidil and all the other medications that they're on to try to reduce blood pressure. Because again, minoxidil, last line agent in the management of blood pressure. On the flip side, if we've got too many medications on board that lower blood pressure, we can lower it too far. So obviously any blood pressure medication, but on top of that, we've got medications like levodopa, alpha blockers and BPH, PDE5 inhibitors. These are all meds that can lower blood pressure while they're maybe not directly intended to be doing that purpose. All right. Well, I think that's going to wrap up the podcast for today. Thank you so much for listening. Do me a huge favor, leave a rating review on iTunes or wherever you're listening. I greatly appreciate that. Share us with friends, colleagues, others interested in learning more about pharmacology. I greatly appreciate that as well. If you want to reach out to me, comments, suggestions, mededucation101@gmail.com. Otherwise, you can connect with me on LinkedIn as well, Eric Christensen, PharmD, BCPS, BCGP. Thank you so much for listening. Take care, and I hope you have a great rest of your day.